quite frankly extraordinary. The speaker will talk about that. Let me just recognize some folks who are here, elected officials who are here. Our controller for the state of Connecticut, Nancy Adams. State Representative Tony Walker. Where is Andrea? Andrea? Where are you? There you are. I saw Pat Dillon. Representative Pat Dillon. Kevin Lembo is here, who is and Nancy DiNardo, our state party chair. And John Olson, head of the AFL-CIO. Where are you, John? I'm going to say a very few words. We do want to, Dr. Missouri will speak, obviously the Speaker of the House will speak, and Congressman Larson, and then we want to open it up to questions from the floor. At the end of the period of time, from about 1:45, 10 to 2, we will entertain questions from the press. So we want to be succinct, and we want to get as many questions in today. I want to just welcome my friends and my colleagues at New Haven, and as obviously Speaker Pelosi and Congressman John Larson. So I'm happy that they could be here with us today. Our first panelist is Dr. Carolyn Missouri, and although she speaks today as a private citizen, Dr. Missouri is Director of Women's Health Research at Yale University, an interdisciplinary research program which she created. She is a professor of psychiatry and psychology, associate dean for faculty affairs at the Yale School of Medicine, with a particular interest in gender-specific predictors of the illness onset and how to deal with treatment outcomes, and actually has been so focused on the issues that are so important to women's health, and we're so grateful for the good work that she has done. And of course, our second speaker is very, very special. My leader, John's leader, and our friend, the Speaker of the House of Representatives, and in so many areas, I will tell you that job creation, equal pay, clean energy, and now healthcare. The Speaker has truly led the way in Washington for positive and transformative change. And when the health reforms become law, let me just say this to you very frankly, that when it becomes law, and it will become law, it will be because of the Speaker of the House, and it's because of an intellect, it's because of a strategic ability, a mastery of the legislation, a mastery of the political process, and of the legislative process. And you couple that with passion, dedication, and tireless effort, and you can't lose on this issue. So she's going to get the job done, and she's going to do it for all of us. You know, I had the opportunity in my career in the Congress. I sat with the Speaker and our colleague Nita Lowy on the Appropriations Committee, the subcommittee on labor, health, education, and human services. That's when we started working together on women's issues, and she is going to and is leading us on this eve of change and moving in the direction that will truly benefit women and women's health. Our neighbors in the 1st District being represented by Congressman John Larson. Our third panelist, the Congressman, has been a key leader in our efforts to build reform in healthcare over the years. As chairman of our House Democratic Caucus, oftentimes the Speaker wants to know why she has 2 out of 8 people from Connecticut in the leadership. He has worked with the Speaker to forge consensus among our caucus members, and he has brought the same kind of conviction and that kind of getting things done spirit, not only to the healthcare fight, but all that he does and all that you know that he's done on behalf of this state when he served in the State House. So thank you so much, John, for being here. Really. I want to just give you 3 or 4 examples of how very, very real this problem of healthcare in women is. I'm going to tell you about a young woman named Celia, a woman who ran a bakery in Houston. I just discovered that her bones had become brittle due to breast cancer, which had by then metastasized throughout her body. After 6 long agonizing months of applications, she was finally able to get on Medicaid, but by then it was too late. Celia died at the age of 52 in horrible pain, all because she could not afford preventive care. To her credit, her gynecologist tried to do what she could to help pro bono, which is going above and beyond the call of duty, but that's not the way it should be. And speaking of going above and beyond the call of duty, another young woman in our community who went that extra mile for people in need, Laura Ryman, a teenager from nearby Wallingford. Her senior year, her Girl Scout project, Lauren worked to find doctors to donate their time to treat low-income and uninsured people in their community who needed help. A woman who was uninsured, Nilsa, a young mother who had been diagnosed with ovarian cancer, who lived with a chronic kidney pain that she could not afford to treat. Lauren could not be here today because, true to form, she's helping to build homes for low-income families in Kentucky this weekend. But her good work casts a harsh light on the fundamental flaws within our system. In this day and age, the sick and the uninsured should not have to rely on guardian angels and Girl Scouts to receive adequate health care. Let me take the case of Jennifer, who's a patient of Dr. Eric Hodgson, who I believe is here. Thank you very much for your work. A Yale and maternal health specialist with us today. Jennifer is a young woman who works at a job that does not provide health insurance. And despite having gestational diabetes in her first pregnancy, she had a healthy first child. That left her at high risk for diabetes, and she could not afford to get the recommended follow-up tests. She became pregnant again. She learned not only that her new baby would have a major heart problem requiring multiple surgeries, but also that she was now a full-fledged diabetic. Her doctor believes that if she had insurance, she might have been able to control her diabetes before she became pregnant, reduced her chances of having a baby with birth defects. So in this case, Jennifer's lack of preventive care not only had a lasting effect on her, but likely on the health of her child. I don't know if Melissa is here.
I am.
Melissa. I met Melissa last night. Went to dinner with my family. She waited for me, and I asked her if I could say this today. And she said yes, I invited her to come. She waited for me, leaving the restaurant, and she said to me, "You've got to pass health care. I have cancer, and the pre-existing condition is killing me." Let me just tell you, the struggle, the tears in her eyes, that's what we're about trying to do for the people of this country and for the women of this country. That's what this is about. Thank you, for being here today. Thank you. The stories that break your heart, and you know my history as an ovarian cancer survivor. They're personal to me. Countless other stories. We need to help women, all women in this country. The panel's going to tell us in detail the comprehensive approach to women's health care, the positive change it will make for America's women. And with that, let me just say, it's about time that women's health care has been put on an equal footing with health care.
Thank you. Well, it's not easy to follow an introduction by Rosa, is it? I'm going to do my best. I want to say, first of all, that it is a real pleasure to be here as a member of this community. This community, in my experience, is genuinely concerned about the healthcare needs of this country and is clear in our understanding that the future of healthcare is an enormously important issue for women. And I also want to say that I'm very appreciative that we have the opportunity today, all of us here in this room, to have a conversation with legislative leaders who, by way of their actions and their accomplishments, have shown us a track record that demonstrates that they really value women and care about the health of women. As we consider, all of us, as we consider the importance of healthcare reform and how to reform healthcare. A central focus must be the fact that women in this country are the greatest utilizers of the healthcare system. And as we craft a healthcare plan for the future, we must do so understanding why women are the greatest consumers of healthcare, so that we can build a system that actually does respond to the healthcare needs of women. So why are women the greatest users of the healthcare system? Well, there are at least 3 important reasons worth mentioning today. First of all, reproductive health is essential to women's health. And reproductive health services unique to women are required in adolescence through early adulthood, through the reproductive years, as an investment in promoting long-term health. Furthermore, and importantly, unlike at the turn of the 20th century, when the average life expectancy for U.S. women was roughly the same age as onset of menopause, women now live an average of over 30 years beyond the onset of menopause. Consequently, specialized health services for women do not end at age 50. Peri- and postmenopausal health care is needed throughout the lifespan, and investing in these services to keep us healthy, in turn, enhances functioning and reduces costs. Second reason why women are the greatest consumers of health care in this country. Women suffer from chronic disease and disability at higher rates than men, with dramatic consequences for our own health and for the health of our families. Women have higher rates of autoimmune disease, osteoporosis, depression, to name a few prevalent disorders. We also die at higher rates of heart attack, are now contracting HIV at greater rates, and are likely to have increased risk for lung cancer with the same smoking exposure as men. The scope of what is women's health goes beyond reproductive health, and our system of care must value women by including early intervention, ongoing and coordinated care, and prevention initiatives that stem the tide of suffering, some of which you've heard about today. Stem the tide of suffering and stem the tide of cost associated with conditions such as these that I've just mentioned. The third reason, women are at greater risk for repeat hospital and office visits because the health of women has not been adequately studied. Thus, we have not yet developed optimal gender-based treatments and prevention strategies that are needed to provide maximally effective care and reduce costs across many conditions, disorders, and syndromes suffered by women. Furthermore, when we have increased knowledge about women's health, translation to practice is slow. Even in considering cardiovascular disease, which affects 43 million US women, with estimated costs at $162 billion a year, where we have finally raised awareness that cardiovascular disease is the greatest killer of women, there is still a knowledge gap in recognizing the symptoms of heart attack and taking action. According to a recent University of Pennsylvania Medical School study, women with chest pain are less likely than their male counterparts to receive aspirin and other recommended therapies by emergency medical service personnel in ambulances en route to the hospital. In fact, among women in this study who had confirmed heart attack, none had received aspirin en route to the emergency room. There is a gap in our knowledge. There is a gap in the translation to practice. And finally, in speaking about how women's health is pivotal to healthcare reform, I would be remiss if I did not mention that we as women largely determine the healthcare for our families. 8 in 10 mothers take chief responsibility for choosing children's doctors, taking them to appointments, ensuring follow-up care. Many women manage their husbands' or partners' health care, and over 1 in 10 women in this country care for a relative with a chronic illness. Therefore, ensuring the health of women indemnifies the health of our families. So as we craft our healthcare system of the future and consider how we can reduce the burden of disease on our population and thus reduce costs, it is particularly important to consider comprehensive, coordinated, and continuous health care for women across the lifespan, informed by new research that can be translated to improve lives and the well-being of the entire population.
Dr. Missouri, we are so grateful that you're part of our community. Thank you very, very much. And now, obviously, it gives me great pleasure to introduce to you the Speaker of our House of Representatives, Nancy Pelosi.
Thank you all very well. Well, in a moment, I'm honored to be here with Rosa and with my colleague, John Larson. Yes, 5 members, right, in the House from Connecticut. 2 of them are in the leadership. They thought that was appropriate. Dr. Missouri is an icon in this country in terms of her leadership on women's health. What we just heard was really the dispositive statement on the relationship of academics and the personal impact in people's lives. It's a wonderful guide to us. But as always, while she has taught us for many years, we always learn something new from her. Dr. Missouri, thank you for your important role. And let me connect some things here. Rosa mentioned when we were on the Labor, Health, and Human Services Committee together, Rosa is there still making her mark with her leadership. And 3 of us, with Rosa DeLauro, Nina Lowey of New York, and Nancy Pelosi, the 3 of us, there weren't any women, unless on the Democratic side, and then later a woman came from the Republican side and didn't necessarily share